I think we're live now.
Okay, we're live. Are we ready to roll? Are we ready to?
You can begin. Yes.
Okay, great. Good. Good morning to everyone. Welcome to the Joint Board of Health and Hospitals Advisory Board meeting. I know it's been an incredibly busy 2 weeks since we last spoke. A lot's been going on, a lot to cover. Before we start, I do know that there are, well, first of all, I want to call the meeting to order and then move that our Zoom recordings from the past 2 weeks would be adopted as reflecting the minutes of the board. So I will entertain a motion for that. That's been moved by Dr. McBride. Second?
Second.
Second by Dr. Swingle. All in favor, please signify by saying aye or raise your hands.
Aye.
Aye.
Any opposed? No abstentions? So moved. Thank you for that. Now, before next, I do know that there are a couple of guests here, and I just see one, Dr. Juifra, and so I'm going to ask Dr. Juifra to introduce himself.
Yes, good morning.
Morning.
I'm Luis Chufra. I am a psychiatrist in town. I've been working in private practice for a number of years, and I have a particular interest in addiction medicine and the opioid epidemic. And I understand that I will be replacing Dr. Swingle for the I don't know if for the remaining of his term, or I will start a new term, but I'm going to take his spot one way or another come January. That's my understanding.
Great. Dr. Swingle is irreplaceable, so it's not like you'll be replacing him. You'll just be in his stead. Okay, so we really
Big shoes to fill. Big shoes to fill.
We really appreciate all that Dr. Swingle did in his time on the board. Thank you, Chris. We'll have discussions about that later. Okay. Normally I would share some data with you. But I don't want to share any data. I just want to talk philosophically, because I didn't see that. We have another guest. I see Steve Conway, our chief of staff from Mayor Lyda Cruzen's office. Steve is he's no stranger to us. Hi, Steve.
Good morning, doctor. How are you?
Thank you for being with us. So I want to share some just a basic philosophy of what's happening, because I guess I'm getting to get philosophical as I near the end of my time as board chair, and I'm thinking about the past 10 months, which really has consumed us. We're all tired. We're fatigued. I know I am, and you know, we're looking at the next quarter next year, and with the fact that the Pfizer vaccine has already been deployed, there's this collective sigh that maybe the worst is behind us. Maybe we're finally out of this thing, and I don't want us to go into the rest of this winter and the next quarter with a false sense of security, because I don't think we're out of this thing yet. I think we're far from it. And let me tell you why. We certainly see the data that Dr. Eccles posts showing that we have about, I think a 7-day average is somewhere around 100, 105 new cases. Our percent positivity of cases is, again, Fred, you may quote me, I'm plus or minus 0.1, 0.2. I think it's around 15%, somewhere in that neighborhood. And what's really alarming to me is that although we have seen after Thanksgiving, we did see a peak in the number of cases, that seems to have plateaued. That's good news. That's really good news. But it has not, new cases have not downturned. And we're going into Christmas right now. There's a whole lot of COVID out there, folks. A whole lot of COVID out there. And it's beginning to affect operations of all our hospitals, including my hospital, Barnes Jewish Hospital, where our ICU rates, rather, our ICU numbers are around 90% occupancy. That's a lot. Okay, so having 100% occupancy means that we would have ICU nurses covering for 1, 2, 3 more very critically ill patients, which is certainly not industry standard. I think that occupancy rate is probably comparable across other hospitals. I don't know that data, but I suspect from the recent report from the pandemic that it's pretty comparable. So we're coming close to saturating ourselves with the coronavirus. So again, I don't want us to have a false sense of security. I will get my coronavirus vaccine on next Tuesday. Proud to be there. Proud to get that at 10:50 next Tuesday, and I want everybody to know that I'm going to step up and do that. But we only have 50,000 doses in the St. Louis area right now, and we're obviously I saw, and you've probably seen the data that maybe we have a 25% reduction in the number of doses coming in from Pfizer. That's less than we all expected. Things are going to get better. We certainly anticipate that once Moderna has been approved, and I think by early February we're going to have millions of doses of corona vaccine in the region. That's great, but a lot's going to happen in that time period, and so I just don't want us to let up off the accelerator at this point. I am concerned, and so I think with that sort of sentiment, it gives you a sense of how we're going to remain very vigilant going into these next 2-3 months. I think it's important that the board really acknowledge that. I was reading a quote. Sorry, reading chat. So I don't think I need to say too much more. I think everyone understands where we're coming from and what we need to do in terms of that type of vigilance. The second thing I want to say is that I have come to after 7 years as board chair, I have come to the end of that term, and it's just been just a remarkable 7 years as board chair and 12 years on the board. I still have 2 more years on the board. I'm not going away. Okay, I have 2 more years, and even though after 7 years my term is up as chair, I will be there to support the incoming board chair and as close as possible, as aligned as possible to guide that person through the first 30 days or 60 days, depending on their desires. You have my commitment to do just that. I'm proud of what this board and what the Department of Health has done in the time period that I've served. I'll let you know that I came in with 5, essentially, maybe 4 or 5 different goals. After 1997, when I completed that review of the city-county governance for then Mayor Clarence Harmon, I stated that we need to have a professionalization of the board. Bringing in staff members who truly have the skills, expertise, but also bringing in board members who have the skills and expertise in public health, who could really bring that level of professionalism, enlightenment, and professional and public health practice to the board. Folks, we've done that. Just look at you. I mean, look at what we've assembled. It's just absolutely remarkable. We hit that, knocked that ball out of the park. Secondly, I felt that once we did that, we really have to become recognized as a state-of-the-art board nationally. And I pushed aggressively to get national accreditation. Guess what, folks, right? We're there, we got that. In fact, we're working on the second phase. Then I wanted us to have a closer connection with our academic medical centers, with Washington University, with SLU, with OMSL, That's why we created that academic collaboration committee. And now we have some of the finest collaborations. Dr. Eccles meets frequently with both medical schools. He's engaging members of the faculty. Check that off also. It's just been remarkable. And then I wanted to recognize that we are one region. We sometimes fragment ourselves into the city and the county, but frankly, as the coronavirus has told us, it doesn't care whose city, whose county. And I thought that we need to have more shared services. We need to create a model where we really are moving in tandem with regards to how we set metrics, how we set practice as a region. We've made progress, and I think that we're more closely aligned than we have ever been. And I think that we're going to get there. So I think that we have an upward trajectory in terms of that. I'm proud of what we've done. We have a ways to go, but I'm proud of what we've done. And lastly, I wanted to bring in a professional as board chair, someone who has a known track record in public health, particularly communicable and non-communicable diseases, someone who has the strength of character to stand up when things go wrong, the strength of character to move, pivot politically, and the strength of character to really speak truth to what this city needs in order to maintain the health of the population. And so with the Chief of Staff, Steve Conway, and Lottie Cruson, we recruited Fred Eccles to that position. And I could be no more proud of Dr. Eccles and what he's done, and how he has really mobilized the health department staff, how he has actually empowered them to step up and do without feeling that they're being micromanaged. I've seen this, and they're doing, and they feel proud of their role, and the community now feels that they actually have that type of oversight. And so those were my objectives as board chair. And there are things that we could have done more, but I think it's been for me, it's just been a good role. And so I'm happy and I'm proud of you. I'm immensely proud of Dr. Eccles and the staff. I couldn't feel better about this. We have a lot to do, but I simply could not feel better about this Board of Health, about the mayor's oversight, and about you, both old board members and the new board members who bring in all this new excitement and all your backgrounds to really make this board even more of an insightful, professional board. So I want to thank you for those 7 years as a board chair. I'm going to hear a little bit more about our new leadership going forward. So with that, then, I'm going to turn it over to Dr. Eccles.
Thanks, Dr. Ross, for those comments, and we're truly grateful for your service as board chair over the last 7 years, and your role as a member of the Board of Health and Hospitals for the last 12 years. We wouldn't be where we are today without your leadership and guidance, and so you set the path for us to do the right thing and move forward and create a better platform for our community to thrive, and so for that, we're extremely grateful. As you mentioned, although the vaccines are being approved, that's not the end. The vaccines aren't a panacea. We don't know what type of immunity or the length of immunity that's going to be granted, provided by these vaccine products. That's something that's going to have to be studied over time. So the prevention measures that we request individuals to implement on a daily basis will still be critical in slowing the spread of COVID-19 and other respiratory conditions, respiratory illnesses that are spread by respiratory transmission. So the health department is geared up to really improve the community's education around vaccines in general. So we're working with the St. Louis Science Center. So they're developing materials, and we'll be also working with the regional response team and other community-based organizations to make sure that the messages or the products that are created can be understood and palatable for the majority of the population in the city of St. Louis and the St. Louis region. So as you mentioned, it's not COVID-19 isn't specific to the city of St. Louis, but it's a region-wide, nationwide initiative. And so we hope that the products that we are creating through this project will be used not only locally and regionally, but also on a national platform as we share information with our partners with the CDC and the CDC Foundation, as well as the National Association for City and County Health Officials. The other big concern is equitable distribution of vaccine products. We know that there's a lot of misinformation circulating, particularly in communities of color. There's a lot of distrust between the community and government, and the community and medical research and the pharmaceutical industry. So we have to do a better job of communicating the facts. So these products are actually safe. They have over 90% effectiveness. The safety profile is good for both products. So we have to do a good job of communicating that to the community in a way that they can understand it. That way, this doesn't become another missed opportunity for us to really meet the needs of those most vulnerable populations that we talk about day in and day out. If we don't capitalize on this opportunity, that will be a tragedy. In a lot of ways. And so the health department is really dedicated to making sure that the implementation of our vaccine distribution protocols are such that they will allow us to equitably distribute the vaccine, making it available, again, to our most vulnerable populations and those others who need it. And so we'll be working really closely with a lot of our system partners. And we've already started having discussions with the Integrated Health Network, our emergency preparedness program manager, Justin Hauser, will be leading the logistics efforts. We're also working with other system partners such as the hospitality and lodging industry, because they're serving as can serve as points of distribution for the city. We're also looking to leverage other resources in the city of St. Louis, such as our fire and EMS department, to help increase staffing capacity so that when the vaccine is available for the general population, we'll be able to assist the federally qualified health centers in their work to vaccinate the community at large. So there's a lot of work to be done. As you mentioned, this is really just the beginning of the next phase, and the next phase is going to be a heavy lift. And so the health department, we understand that we cannot do it alone. We have to really leverage the resources across the system, and that's our plan. We've already started that work. One thing, as I mentioned before, we want to make sure that the community has accurate information. So we've developed an FAQ that we hope to get out later this week. And that the role of the FAQ is to make sure that individuals understand, one, the role of the vaccine, give some general background information about what vaccines are, but then also talk about what the tiered approach for the distribution of the COVID-19 vaccine, what that needs to look like, because there's still a lot of information that's lacking in a lot of the plans that have been circulating around, who's technically in phase 1 and phase 2 and phase 3. And so our goal is to really define that so the community can understand when, what phase of the distribution they will actually be eligible to get the vaccine. So that's going to be another critical part of our response as well. So overall, the city, as we look at our COVID-19 numbers, we are still faring a little bit better than the rest of the region. Our 7-day case average is 105, which gives us a 7-day case rate of roughly 35 per 100,000. Hospitalizations aren't exactly where we want them to be. Some of the ICUs are still at 90 to 95% capacity, as well as the inpatient beds. So, and that's kind of standard across all of the hospital systems. So we're monitoring that really closely. We're also looking at the percent positivity rate as well. So that's a great indicator of the amount of virus that's circulating in our community. Right now, we're hovering around 15%. And again, that's lower than the other jurisdictions in the region, but we still have a ways to go. We're not satisfied with being at 15%. Our ultimate goal is to be at or below 5%. So we have significant work to do, and that's again going to require working with our system level partners, as well as the community-based organizations and those who have grassroots footprint in our communities to make sure that accurate information and resources continue to get out to those individuals who need it. We have received funding for the special project that we're doing with our clergy advisory board through the Centers for Disease Control Foundation. So they'll be granting the health department $200,000 to provide education, information, and care packages to laypersons in the community. We really wanted to capitalize on this because this is the first time this is really being done in the country. Another product that will come out of this is messaging specific for faith-based communities. The CDC Foundation and the CDC are really excited about this project because to date, specific information or specific messaging for communities of faith has not been developed. And so we'll be leading the charge essentially nationally for this. And so we're really excited about this. We're excited about the individuals that we brought on as clergy advisory board members, as well as the co-chair, Dr. Kanika Turner, and the work that they've been doing. They're really engaged and they're really excited about not only lifting the work that's needed for COVID-19, but also other public health initiatives such as HIV, reducing stigma around HIV and among communities of faith, which is huge. And so we're grateful for them and grateful for the work that they've been doing, and also, more grateful for the work that that they'll be doing ahead.
Okay, so questions for Dr. Echols. Dr. Maddie?
First, I want to thank you, Dr. Ross, for your years of leadership on this board. I am a recent member, but during my time in St. Louis, the footprint that you've left in fighting so many of the issues that the city has seen through, from public health to social and racial injustice, is just aspirational and phenomenal. So I just wanted to say thank you so much for all that you have done.
Thank you.
Dr. Echols, thank you so much for that update. I had two lines of questions, but I'll start with the first. The first was just in reflecting on Dr. Ross's thoughts, about this year, what COVID has meant, and really continuing to be vigilant. Just an update on the motion that was passed at our last meeting around capacity and overall businesses, and any thoughts and reflections about if we need to continue to look at this.
So we looked at the data, and we also looked at the information that's coming through through the cases that are being reported. And so the restaurants are really not where transmission is occurring. I know there have been a lot of media headlines around some recent activities regarding noncompliance. And so we have protocols in place to address noncompliance, and we're following those. We're actually implementing stricter measures at this point to make sure that we protect the public health. And so at this point in time, staying the course is really, I think, in our best interest, as well as the best interest of the community at large. There's a lot of unintended consequences that are associated with, reducing capacity or even closing businesses. And so we are really mindful of that, that we don't really, at this point, we don't have additional support for our most vulnerable population. And so to put them in a worse condition will be really tragic for us. And so I'm just being mindful of all of the nuances that and the consequences and activities that can result from additional restrictions.
Tim.
First of all, I just want to second the comment that Dr. Manny made. Dr. Will, you and I have worked for together like 12 years, and we're like, in sync the whole time. Joined at the hip. We always working together, and your commitment to racial justice and public health and is unparalleled in the community. So, and you've seen us through some really difficult times here. I just can't imagine how you've done it. Your leadership skills through a pandemic, a recession, and racial injustice has been incredible. Your professionalism, your skill has been amazing. So, and thank you for your 7 years of leadership. So I really appreciate that. And I know we all appreciate that. We can't imagine how we'll cope without you, but I'm sure we will. So thank you for staying on the board. So thank you for that. Just had to say something. So just a question for Dr. Echols, and thank you for your continued leadership too. So on the question that was asked, so the data that you're talking about on the restaurants and the businesses and all that, is there a place on the website or such that we can see that kind of data that you're talking about that backs up the kind of statements you're talking about, or is that sort of a place that something that can be shared with the board about the sort of underlying data that you're talking about? Because we've heard in a couple meetings that it doesn't back up the theory that we should be doing anything other than staying the course in terms of restaurants and small business orders, and that really what's driving this is something else. Do you have something that we could see or you could share with us?
What we use is the information that we're collecting from the individuals that test positive. So unfortunately, the state's database doesn't have a field where that can be captured, and so we meet with our case investigators twice per week, and that's where we're getting that information. And so when we identify clusters, outbreaks, right now most of them are associated with again small gatherings, and then we're also seeing an uptick in long-term care facilities. So we've re-engaged the long-term care facilities. Earlier this year, we did a survey. Then most recently, I think within the last month and a half, we did a second survey of all of the long-term care facilities. And so for those who we identify as having clusters or an outbreak, we reach out to them directly to provide them with additional support in the form of additional PPE, as well as infection control guidance. So that's been our practice. Unfortunately, due to the limitations in the state's collection surveillance system, we weren't able to run reports on specific venues or venue types related to COVID-19.
Are there reports of the types that you have about the cases that are up on the website, or can be shared?
That's not on the website. The aggregate data is really on our website. The information that I'm talking about is information that comes directly from our case investigators. So again, we get updates from our disease investigators twice per week, and they inform us of what they're seeing, what information they're getting from their cases. So that's how we know where the exposures are actually occurring.
Okay.
Fred, I had one question again about distribution, and it's mostly regarding the Pfizer and the Moderna vaccine. The fact that they are sent under extremely cold conditions, and then when they're reconstituted, they have a shelf life of only about 6 to 8 hours, and so that means it's going to be terribly hard to decentralize the administration of these vaccines. You mentioned a number of sites where individuals could access, but I want you to clarify that, because based on my knowledge of the vaccine preparation, it really is going to be necessary to identify only a number of sites where we can store the vaccine, distribute it quickly, and then vaccinate the public. So the number of possible distribution sites would be significantly less than the public currently understands.
Right, absolutely. So we're only looking at having 3 pods, and that's at most. And so we want to make sure there was a pod in the north part of the city, central part of the city, as well as the southern part of the city. We're still fleshing out the details on that, because again, there are some significant limitations on the with the vaccine and how they have to be managed and stored. And so, but we are also working with the FQHCs who have some storage capacity internally for vaccine. The biggest challenge I think right now is for the Pfizer vaccine, because it requires essentially ultra cold storage at -80 or -70 degrees. And so not every medical facility has that type of storage. I know that Pfizer is planning to send out small units that can be used to store individuals at -70 using dry ice, but those haven't been deployed yet. And so we're kind of in the wings waiting for them to let us know what the next phase is going to be for the city of St. Louis. I've been in direct contact with their regional representative as well as their state representative. And so they're working really closely with the city of St. Louis Department of Health on our plan. We also submitted a request to them to provide information in the form of a town hall to St. Louis residents about the Pfizer vaccine and what efforts were made to make sure that it was safe for the community. And so we're hoping to have that session in early to mid-January. For the Moderna vaccine, the storage requirements aren't as strict or And so I think that it has to be required stored at -30 degrees. And so most of the FQHCs already have a freezer or storage capacity for a freezer that can store things at -30 degrees. So that doesn't seem to be a big hurdle, but right now it's just the quantity. There's no Moderna vaccine that's been distributed. So we're just waiting for the FDA to approve that under an emergency use authorization, which we hope will happen today. When that becomes available, we'll work with the state, because the state is issuing the vaccine to our partners across the region. And the significant quantity limitations at this point in time, the first batch or the first allocation of COVID-19 vaccine for the state of Missouri was only 51,675 doses. And so that's, extremely limited. And so we have to make sure that, again, we're adhering to this CDC's tiered or phased approach to make sure those individuals who are most likely to not only be exposed to COVID-19, but to contract COVID-19 and have severe complications are prioritized.
Great. Dr. Maddie?
Thank you so much for your answer to the previous question and for updating us with that information. I would definitely be in favor of us continuing to look at this topic with a very close eye, especially given the morbidity and mortality we're still seeing in this winter season. And definitely from a global public health perspective and thinking about unity in the region as well, and what has been effective in other jurisdictions. My second question is about this very topic. And I know that, we've talked a lot about inequities. We've talked about the disproportionate morbidity and mortality in Black and Brown communities. And a lot of us I was on a meeting with there's a National Infectious Diseases Society of America. And within that, I'm on the board of directors of the Minority Interest Group that houses all of the African-American infectious diseases physicians from that society. And our concern was twofold. There's this thought around vaccine hesitancy, where you talked a lot about getting and disseminating information in an accessible way, which I think is important. But it was also important to us to highlight that there's a lot of people in these Black and Brown communities who want it and for whom access will be an issue. And so it's very, very encouraging for me to hear you speak to working with community partners, having pods that are equitable. But I do think that a transparent allocation and distribution plan will go a long way to dealing with mistrust. And I just wanted to get your thoughts about how maybe the board can be a part of that transparent allocation and distribution process when thinking about the inequities that have existed in the past.
That's a great question. So we're actually, we'll be fine tuning our plan over the upcoming week or two. So I'm working really closely again with our emergency preparedness program, as well as the Integrated Health Network and the federally qualified health centers, because we want to make sure that whatever is presented, everyone is agreement on what their role will be in helping achieve what's outlined in the plan. But I think our plan is to share that information not only with internal stakeholders, but also for the community, so the community will understand our approach and what we're and how we're going to be addressing or working to prevent the inequitable distribution that has really plagued our city in the past. So that's at the top, one of our high priorities, and this is something that we take really seriously, especially when we look at the pre-existing conditions, what was present before COVID. So a lot of these issues were here before COVID. And so I tell my staff, we have an opportunity to do something different. And we don't want this to be another missed opportunity. And so we're engaging system stakeholders. Again, we're thinking outside the box about who we bring to the table. So I think this is the first time that we've had an official contract or partnership with the St. Louis Science Center to do the work that they do all the time. So they specialize in providing educational materials related to science and STEAM topics to the community at large. So they're a trusted entity. And so we'll be working really closely with them to get products out. But this is a system level effort. And I think the city, the health department, we've engaged the system in a way that hasn't really been done before. And we're looking to make sure we follow through on our priorities and our promises that we have for our community.
Thanks. I want to move the agenda along. The next on the agenda is an update on evictions. Many of you are aware that the federal guidelines for funding to reduce evictions is tentatively scheduled to expire at the end of December. I don't know if there's going to be an extension of that. And you certainly know, as a board, we have taken a strong position on this and made that statement that to process evictions will be a public health hazard in the setting of a pandemic. And we're really fortunate that Judge Burleson has made a number of rulings to support that stand. So I really appreciate his leadership in this era. So Dr. Echols, can you give us a sense of where we are right now on the state of evictions in St. Louis?
And so as everyone know, everyone may not know, housing and although homelessness is a public health issue, that those efforts are led by the Department of Human Services. And so I have Mr. Stephen Conway, who's going to provide an update on where we are with the eviction programs, as well as the rental and mortgage assistance efforts of the city of St. Louis.
Okay. Good morning again, doctors and everybody here. A couple of things. One is that there's two bills in Congress right now, and I haven't checked my updates yet, but both of them do contain, at the federal level, an extension of the CDC, in essence, the CDC's moratorium on evictions through December of 2021. That's significantly different than the eviction moratorium that Judge Burleson has. Judge Burleson's is basically a universal, no questions asked eviction moratorium. By Friday, which is technically tomorrow, we'll have a clearer understanding of which way Congress is moving on all of these issues. Basically, I'll call it CARES Act 2. As to where we're at today, when the city received its $35 million in CARES Act funds, Mayor Cruzan had directed that we look and mitigate the economic and financial hardships that were going to be wrapped upon our community by the COVID. And to that end, the vast majority of our funds have gone to homeless services, to eviction and mortgage assistance, and utility assistance, and the homeless services. So more than half our funding went to one of those categories. What I can tell you is, since we opened up our application process for mortgage and rental assistance, we've received 9,000 applications. 88% of the applicants are seeking rental assistance and 12% are seeking mortgage assistance. In order to process all of these applications, we are using the United Way as our master organization that distributes the applications out to 14 other not-for-profits. Each of those not-for-profits do receive a small administrative fee. To date, as of last Friday, they've processed and paid 1,700 landlords the actual back rent for units. An important component of what we're doing is we've engaged a conflict resolution center and other, a couple of other lawyers groups to work with mediation also to help many of the people out. Couple of problems we've been overwhelmed with the number of applications. We have 14 providers, and they're all well-known names. Some of you, a couple of them that I know are publicly known: Catholic Charities, Urban League. All of these people have experience in delivering these deliverables, and that means actually getting the rent paid to the landlord. I'll give you a couple of other perspectives. The organizations have reached out to 4,900 of these applicants. 34% were eligible for funding and received assistance. 30% of the applicants never responded back. And I think a lot of that had to do with the fact that they weren't either eligible or they didn't realize they weren't going to get the check. Many people thought this was just going to be a check straight to the tenants, but we're making sure that the rent gets paid. 28% of the applicants did not meet the eligibility requirements, and then 8% were self-resolved. As to the people that are being in the eviction process, whether it's rent and possession, unlawful detainer, we have a relationship with the family courts, and everyone that has a, quote, eviction filed against them gets this information. We process their application as the priority and move it up to the top. So if it's an eviction for rent, that will get moved to the top of the list. And I think when this first started, there were 44 evictions going on back in June or July. I can't even remember now. The time period has run so long. Of those 44 original people that were in eviction, only one had applied for rental assistance. So the family court over in the 22nd Judicial Circuit has done a very good job relaying the information and working with our providers to get the funds out. A couple of complexities still exist for us. As you know, that the CARES Act funds has to be spent by December 30th. Now, that's just common knowledge. Actually, the Treasury has issued regulations that I can pay the December rent in March, the November rent in February. They give us 90 days to make that payment. We have spent to date actual cash out about $4 million. We have $7.4 million in. We hope that we can continue to process these through January, February, and March and make those payments. The drawback with the law that's going to hamper us, and we've gone back to these providers, is that I can pay the rent, but I can't pay the administration fee after January 1st. So a couple of the providers, have agreed to continue to process these and not charge us an admin fee. I will also tell you that we got an extra $2.3 million in community development block grant funds that will be available in January to us to continue this program. Now that's slightly different funds, but all of these organizations would have the background to legally comply to make the distribution. In both bills in Congress right now, the funds are there to continue the rental and mortgage assistance program payments. Our main hurdle is to make sure that we do a smooth transition of wherever we go, to make sure that these can continue to be processed. As Dr. Ross had said, this financial and economic hardship that's being forced upon our residents is going to continue way past the time in which this vaccine is distributed. As to the homeless individuals here in the region, we've dedicated a combination of FEMA funds and CARES Act funds to open up an additional 285 beds that the city has made available. We've also, just in the last couple of days, finalized a couple of new locations for overflow shelters. Most of the homeless providers have experienced a significant drawback in the number of people that they can service. With social distancing, and in each of these places, they basically cut their occupancy rate by 50%. And then they're also having problems with their volunteers. The homeless individuals, already have a stigma within the community. And now with the COVID, the volunteers and the other people that will support and staff them are hard to find. We look to process all of these applications in some combination or another. Right now, the one thing is, it is very, very hard to comply with what the federal government wants on the documentation that you've been impacted by COVID, that you have a lease, that you owe the rent. And the organizations that we're working with, I think we've really uplifted them, and they are accelerating how many that they can process, but it's not going to be enough. And there are not that many other organizations available to go ahead and process and do this work. But we're very, very comfortable that our priority will always be on the eviction cases, as long as they're evictions for rent. So there'll be a number of questions going forward. I have not talked to Judge Burleson. I think everyone's going to take a little bit of the wait and see attitude to see really how restrictive what will come out of Congress regarding an eviction moratorium and how it may or may not impact our residents.
Thank you.
I'm pretty open to any questions anyone might have.
So we're going to have to hold on questions because of time. We want to get through a nominating committee report by 9. So I think we have time for only one pivotal question. So that was you, Tim. So a quick question.
Oh, yeah. Thanks to the mayor's office for presenting, and I loved all the data. I'm a data geek, as everybody knows. So I just sort of wondering, and I will point out that this morning, the numbers, just to accelerate your point, came out that the unemployment numbers came out and they're not going down, they're going up. So if anybody's listening, this problem's not going away, it's going to accelerate. So I hope that, people know this problem's not going away. So I wonder, just, can you tell me, just so I can calibrate this number of 9,000 or 4,900, do you know what the total base is in total housing units? It seems like a large number to me, but how many units is that relative to the city?
So Steve, we're going to need a quick response.
Sorry.
Response.
Oh, I believe that there's over 109,000 residential buildings in the city of St. Louis.
That's a pretty big base, pretty big percentage. Okay, thank you.
Okay, Steve, thank you. That was an incredible report. We are informed. I think I'm relatively reassured with all the constraints you mentioned. I'm relatively reassured that the process is ongoing for review and that we've addressed the critical members of society who are unhoused and prioritize them. So thank you for the report and your leadership. Obviously, your immense knowledge of this particular issue. We're very informed. Appreciate that, Steve.
Thank you. You're welcome.
Okay, so I want to move quickly to nominating a governance report. And so I think I'll turn it over to Linda Racklin.
Thank you very much, Dr. Ross. I would like to first place ask those candidates who will be presented for a vote if they would mind dropping off the call, and then we'll reach out to them after we've had a vote and ask them to rejoin us. I also wanted to give a special welcome to our relatively new board members who we have voted on, Dr. Jufra, Dr. Muhammad, and Dr. Mahdi, who are here today. Thank you for joining us and for being our new board members. So as Dr. Ross mentioned, we are so thrilled with the tenure of his service, and these are big shoes to fill. And it was a very big task for myself and my fellow committee members, Chris Swingle and Paul Lee, to approach this task of finding a chair to fill his shoes, especially during the time of this global pandemic with so many health equity concerns pressing on our community. I am happy to report, however, that within our very board ranks, we have some tremendous talent, and that I would like to offer for the board that through the consideration of our committee, who worked very closely with Dr. Ross in considering the qualifications necessary for the position, that we are very pleased to recommend to you Dr. Rhonda Bellew as our next board chair. And we would like to bring forth her nomination to you as our next chair of the Board of Health and Hospitals. For those of you that do not know her background and credentials, she is a professor at St. Louis University. She is the Department Chair of Health Management and Policy at the College for Public Health and Social Justice. She is known throughout the St. Louis region for her outstanding advocacy on health equity. As I think some of you knew from an email chain earlier this year, she was recognized by St. Louis Magazine as one of the premier leaders in health equity throughout the city. Her research focuses on a variety of areas in health equity, certainly focusing on non-communicable diseases, mental health, or in organizational development. I think we were all those of us who had the privilege of seeing her at the recent Institute for Public Health's forum on COVID were very impressed with her facility at dealing with a wide range of interests and individuals from different perspectives. We think she will be an incredible asset to our board and our mission and our work with Dr. Eccles. Dr. Ross, would you like to say a few words on behalf of Dr. Bellew?
Yes, thank you, Linda. I've worked with Dr. Bellew for many years, and I would certainly concur that she is an astute public health scholar, and a scholar who understands the political framework of this region. That's so important. This is a very political board, and it's important to have someone who knows how to navigate, how to listen, and how to, in many ways, really advocate aggressively for the community we serve. And so it just means someone who really has their tentacles in multiple spaces and the ability to really bring together a consensus around sometimes really controversial topics. I have complete confidence in Dr. Bellew, and I'm proud of the nominating committee for bringing her name to for consideration. And so we're going to deal with these individually, Linda.
Yes. Well, let me just go ahead and say that we also wanted to recommend to the board that we'd like to have Dr. McBride continue in his role as vice chair of the board. We are thrilled, and I would have to say somewhat relieved, that he was willing to serve again. I think he has I'm sure most of you know, Dr. McBride is a well-known professor of health economics at the Brown School of Public Health. I'm proud to call him my colleague. And he has been our vice chair for many years, and he's happy to continue serving in that role. And I'm just thrilled, but we do need to bring him forward for a vote. This is a vote for a 2-year term that would commence in January. And we do need a vote of 7 board members, Dr. Ross.
Okay, then great. So let's move with those in order. We'll start with the nomination of Dr. Rhonda Bellew as board chair. So is there a motion? Well, this is coming from the nominating committee, which is a component of the board. So it doesn't necessarily need a motion. It needs a second. Is there a second for that? So seconded by Justine Craig Mayer. All in favor, please signify by saying aye.
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 Any opposed, say nay. Any abstentions? Hearing none, the board enthusiastically and unanimously brings on Dr. Rhonda Bellew as the incoming board chair effective January 2021. Great. Okay, so the next motion is for Tim McBride to continue to serve as vice chair. That is a motion coming from the committee, so it does not need another motion. Is there a second?
Second.
Second by Lisa Richter. All in favor, please signify by saying aye. Aye.
Aye.
Aye.
Any opposed?
Aye.
Any opposed, say nay. Any abstentions? It is so moved. We again enthusiastically approve the nomination of Tim McBride as vice chair. So let's congratulate them and bring them back to the meeting.
Okay.
So we'll congratulate them when they come in the meeting. You're not through with your report yet, Linda, but we'll bring those. Can we bring them back to the committee, to the meeting?
Yes, I'm going to just send them a quick email now to let them know that we're ready for them. And okay, so I have emailed them and hopefully they will rejoin us.
Okay. Okay. Yeah. So while they're coming back, then I wonder which.
I hope they'll be able to jump back in time. I know we're coming up on the end of the hour.
We actually, no, okay, I think we have some time. Okay, let's move on and complete your report because we certainly, we're pleased that the mayor moved to on the nominations of Serena and Mahdi, who are now full-fledged voting members of the board. There were other members who were being considered, I think Dr. Mimi Vo, and we have the, I don't know if we formally voted on the Dr. Luis Jufra. Yes, we have. So I think we're fine. They're just, Dr. Jufra is just simply waiting for the mayor's vote. So, actually, I think that sounds like we've pretty much completed that report. Linda, is there anything more you want to comment on for your committee?
I don't think so, Dr. Ross. I mean, I think with the addition of our new members and voting on our chair and vice chair, I think those are our major pieces of work for now. So I think that's all we have.
Great. So do we have Rhonda and we have, I don't see Tim. Is Tim back? Okay, just in just a minute. So where's Tim?
Point of clarification.
Yes.
So all the letters went out to the candidates, but we only had 3 slots. And so Dr. Mahdi, Serena Muhammad, and Dr. Jufra are filling those slots. So
okay.
Dr. Mimi Vo will be, I guess, in the queue on the waiting list. Yeah.
Great. Okay. So I don't see Tim. So, but we do have Dr. Bellew back. And so Rhonda, the board has unanimously and enthusiastically supported your candidacy. And so you are now the board chair elect. So we thank you. Congratulate you.
Thank you. Thank you very much. I am honored, and I know it's a tremendously large, brilliant, fancy shoes to fill. To come behind Dr. Ross. I'm so very much looking forward to Dr. Ross's mentorship and guidance as I step into this position. And I am grateful and honored to work with everybody on the board. Having been on the governance committee the past few years, and I've seen the folks that have come onto the board, and it's an honor to work with everyone on the board. It's a wonderful group of people, and it's certainly a big charge and again, big shoes to fill. And I'm really looking forward to being of service. So I guess, it's what the position is really being of service to the city health department and to the city in general. It's exciting to me. Before I went into academia, I was actually worked in the Metro Health Department in Nashville. Reminds me a lot of St. Louis, so it's getting me a little bit closer back to my frontline public health worker days. So I am just honored for the opportunity, and I'm ready to do the work. And I'm grateful to Dr. Ross that he's not going anywhere, that he's going to be around, because I'm going to need his tutelage and mentorship and all of that. And again, it's definitely an honor. So thank you so much. And then I know Tim, my buddy Tim, we're going to get to work together. We're going to have a fun. So
thank you. Before we hear from Tim, just a comment. I don't know if Justine just signed off, but Justine is also moving off the board, and essentially her recommendation was to bring on Serena Muhammad. And so really, Serena, you really are kind of bringing in that, backing up Justine. Sorry, Justine, I think she just stepped off. I wanted to say that before she left. Also, before we hear from Tim, I just want to make sure, in case Dr. Swingle has to leave, we wanted to thank Dr. Swingle for his time on the board, bringing in that perspective of a physician, a leader in the Metropolitan Medical Society. So, Chris, your voice has been irreplaceable. Thank you, Chris.
Chris has been a really wonderful to work with on the governance committee. I just wanted to say that I've gotten to work with him closely, and he's been.
Well, thank you very much. It's been a pleasure.
It's been our pleasure, Chris. So Timothy McBride, Tim, my friend, the board loves you and wants you to remain in your position as vice chair. So let's give Tim an applause for that. Tim, comments?
Oh, thanks. Well, I guess I can't run away. And thank you for that vote of confidence. I appreciate it. As much as I've, as I said, Will and I have worked together for like 12 years, and we're like buddies, always side by side and always in sync. And I'm continuing to get to know Rhonda, and I know that we'll be in sync the whole time. So we have the interests of the St. Louis region and heart and public health and social justice. The times that we've talked together, I know our spirits are in alignment in what we want to do for the region. So, Will gives us the light and how to go forward and how to do this job. So, as I told the board, I knew you were the right person for this role. So you have the academic leadership, the academic chops, the leadership skills to do this. And I'm just sort of the cleanup person to just make sure that I just sort of say, well, remember to do this, remember to do that, and try to help Fred do his job. Sorry, Dr. Eccles, do his job. So I thank the board for their endorsement. We live in really difficult times for this region, and I always try to keep that in mind. The vulnerable citizens that we're not out of this. I don't think we'll be out of this until July or August. We have a lot of poverty. We have a lot of, if we heard about this morning, and a lot of suffering going on with the pandemic, racial injustice. And so we got a ton of work to do, but there's sort of a ray of the doors sort of opening with a little bit of light with the vaccine going on. So I think with the leadership that Will has shown us to get us to accreditation, professionalization with the new members of this board, and now Rhonda can take us to new heights, I think. So thank you for your endorsement. I appreciate it, and let's go forward.
Thank you, Rhonda and Tim. And Rhonda, the board has asked that I stay close to you when on the first meeting in January. I will start the meeting, and I will promptly turn it over to you as incoming board chair. But I will remain really close, and we'll be meeting frequently to guide you through the next those 30 days. And if you need assistance beyond that, then obviously I'll be there. But essentially, I will be your shadow for the first 30 days on the board. That's a mandate from the board that I have accepted. So you don't have to worry about that. I will be there.
Yes, please. I will. Grateful for your for having you as a shadow. I might social distance show up on your porch before the first meeting.
we may have to do that. Okay, very good. Linda, is there anything more from your committee?
No, Dr. Ross, we're all set. Thank you.
Okay, great. Thank you. I don't know if there's anything more from the Academic Governance or the Communications Committee. We've already talked a lot about those communications. So in terms of the next agenda items for the next academic year, Dr. McBride has been working on, as we all know, on the Medicaid expansion front. We were just chatting. I think it's important to hear from Dr. McBride on where we are with Medicaid expansion as quickly as possible in the new year. And so, Dr. Bellew, I'm going to put that on your agenda to talk with Dr. McBride about that. He's working with Sidney Watson, Professor of Law and Health Policy at the SLU. So I'd like to have you kind of move ahead with that. And also, Dr. Eccles gave us a great overview of where we are with vaccine distribution. We will be heavy into that in the first part of January, Dr. Bellew. So I would like to have you follow up with Dr. Eccles to really give us even more of a really deep analysis of where we are. And so my recommendation is that we spend the better part of our next meeting in January on the vaccine distribution plan that Dr. Eccles provided us. Clearly has this finger on the pulse and talking about the 3 nodes, regional nodes. And so we just want to make sure that the public is aware and we can address some issues in. I will have no further control over the agenda in January, but those are my recommendations for our next meeting. So with that being said, I'm going to turn it over to Dr. Eccles for other agenda items.
I think the only additional agenda item that we have is going to give the board an update on some of the legislation that will be presented to the Board of Aldermen in January. So we're updating our food safety code. So the draft has been completed, and we'll be working with the mayor's office to get that submitted in January. I believe the Board of Aldermen, they're going on winter break here shortly. So we'll have that submitted in early January so it can be approved before they go on break in February, because the Board of Aldermen will be out of commission for February, March, because this is a mayoral election year. So we have that, as well as some other federal funded projects that we'll be submitting board bills for come January, to make sure that we were able to receive those funds from the federal government. In addition to that, we're making some headway with our federal CARES Act funding. So we received special funding from HRSA as well as HOPWA to make sure resources were available for individuals living with HIV in the region. And so we're working with all of our subrecipients to get those funding, to issue that funding, or just expend those funds to make sure that resources are available to those who need it. Those are really the major updates that we have at this time. During the January meeting, I think at some point we'll also need to have a personnel update. There have been significant changes in the health department's infrastructure, as well as we've added some additional positions. So I'd like to talk to Dr. Bellew before the January meeting to give her an update, a status update on what the health department is and what our goals are for 2021. So she'll be up to speed on that before the next meeting.
Yeah, we're going to be a very busy next meeting. And so obviously, Dr. Bellew, you're going to have to be doing some updates and some meetings, some pre-meetings before then. Serena Mohammed certainly wants us to follow up on the evictions discussion too, and I think that she's correct. There are a lot of issues that need to be addressed there. So that's also on the agenda. Thank you, Serena. And so final issue. There's a chat from Linda about board orientation, and I absolutely agree that Rhonda, you and I will talk about that, about actually having a way to really onboard the new members, which we could we'll have to talk about that. Okay, Tim.
Yeah, sorry. There's a lot on that list, and welcome to the role. Dr. Bellew.
She's already perspiring. So
yeah. and I'm sure Dr. Ross will tell you that I'm sure something else will appear on the list before January. So one other one that I mentioned earlier, if you wouldn't mind put on the list, is mental health. Because I had brought that up last time, and but I think the other recommendation I would make, because that list is too long for one meeting, is we may sort of think about prioritizing it, and you could work with Dr. Eccles, I think, and figuring out what we need to hear in January and what can go into a future meeting. And I mentioned the Medicaid expansion, for example. That's the plan amendment goes in March, and it starts in July. So, if you need to have that at a later meeting, that's fine. But if you're eager to get a quick story about what's going on, I'm fine to do that. I talk a lot, so you can force me to do a 3-minute one, but and I can do one later too. But so we're doing a data analysis of that. So anyways, what my main point is, you may want to look at the full list of 12 items and figure out which 4 to go in one meeting and which 4 to go in the next meeting.
Sure. I'm sure Dr. Bellew will do a great job of prioritizing that. We have confidence that she'll give us the high priority items in January. With that being said, Dr. Eccles, if nothing further from you, are there any other comments or actions or agenda items from the board?
The only other quick thing is, Stephen Conway mentioned that there's a bill that may pass in Congress on Friday. So the health department, we've already started thinking about our priorities for how we would utilize the federal funding to address issues that are resulting from this COVID-19 pandemic for 2021. And so, we'll send out information to Dr. Bellew and the rest of the board, letting you all know what the health department's priorities are, or city government's priorities are for expending those funds to make sure we're doing them in the best interest of the community. And so I'll hope to get that to you all. If the bill is passed on Friday, we'll make sure that goes out before the end of the year too.
Okay, thanks. So as the board knows, we customarily would meet in non-COVID settings every other month with committee members, meetings between then. We went from every other month to monthly, and then we've been doing two weeks with all this going on. 2 weeks will be Christmas Eve, be New Year's Eve. I don't think we need to be here New Year's Eve. So the next meeting would be January 7th. It's my recommendation that we set a meeting for January 7th. Is that okay with everyone? Rhonda, shaking your head. Okay, that will be your first meeting as board chair, Rhonda, January 7th. Okay, well, thank you. We covered a lot of ground. Thank you, Rhonda and Tim. Thank you, Fred, for your leadership. It's just absolutely, again, I want to reiterate, it's been my pleasure to have seen you step up to the helm and guide us over this time period. And I feel things are in very, very good hands going forward. So thank you all. I hope you have a happy holiday. Stay safe, and we'll be seeing you at the break of dawn of the 2021. Bye-bye.
Thank you.